Hello, today I'm going to talk about Restless Leg Syndrome, also called as RLS. So, what is Restless Leg Syndrome? So, basically, it's a condition where people have uncomfortable sensation in their legs, as the name suggests, and this sometimes they have difficulty in describing what they are feeling. So, they can say it is a kind of throbbing sensation, some vibrations, something like creeping sensation, crawling sensation. So, all kinds of sensations which are uncomfortable, and this typically occurs in the legs, but other parts of body like hands and chest can also get affected in some cases. And because of these uncomfortable feelings in the legs, the patients often have a tendency or urge to move their legs. If they keep the legs moving or jerk, then they get some kind of relief. And typically the symptoms are worse when they are resting. So if they are driving for a long distance or sitting and watching a movie for a long time, or when they go to sleep. So at night also, during sleep, the symptoms tend to get worse, and which causes sleep disturbance in many of these patients. So then, how do we diagnose RLS or restless leg syndrome? So it is a clinical diagnosis, and to diagnose, the patient should fulfill this following criteria. So first is there should be abnormal or uncomfortable feelings in the legs, which can be creeping sensation, crawling sensation, tingling, or just pain in the legs. And this typically occurs when the legs are inactive. So when they are sitting for a long time or during sleep, it tends to get worse. And to get relief from the symptoms, people often move their legs. So they tend to get up and start moving, or just jerk the legs, and that gives relief of symptoms. And then there should be no other reason which can explain the patient's symptoms. So now once we know that how we diagnose and what are the main symptoms, then the question arises, why do people suffer from RLS, or what is the underlying cause which can cause RLS? So in most cases the cause is not known, and that is called as primary RLS. In a small number of patients it is due to genetic problems, genetic defects, and then there is a group of something called as secondary RLS, where due to other diseases RLS can happen. And one of the major things which we know is Parkinson's disease. So many of the patients who have Parkinson's disease can get RLS, and there are people who get RLS first. Later on, some of them can develop Parkinson's disease. And then the basic defect is it is based on the dopamine pathway. So dopamine is something that is required for proper smooth voluntary movements of many muscles. And in this condition, there is the pathway of the dopamine gets affected, and that is the underlying mechanism. And then some people can also get it because of deficiency of iron. So iron deficiency is also known as a cause of RLS. There are certain groups of medications like medicines to control vomiting, medicines to treat some psychiatric disorders like antidepressants or antipsychotics. So these medicines can also cause RLS like symptoms as a side effect. So now that we know what are the main causes and what are the main symptoms, and then we have confirmed the diagnosis, then the next point is how do we treat these patients. So if there is an underlying cause, like if somebody has deficiency of iron, obvious answer is to give iron supplements. Many of the patients would feel better. If it is due to drugs, then we have to reduce the dosage. If we cannot stop them, stopping is the best. And so stopping the drug or modifying the dosage can help many of those patients. If there is no other obvious cause, and then it is called as primary RLS. So there the two groups of drugs are used. One is this anti-epileptic drugs, mainly in that gabapentin and pregabalin. So these drugs, even though they were initially used for epilepsy, now no longer they are used for epilepsy. They are mainly used for treating neuropathic pain and nerve-related pain conditions. They also work in restless leg syndrome. The second group of drugs that help in treating RLS is dopaminergic drugs. So in that, ropinirole and pramipexole, these are two main drugs which work for these patients. And then the last point is, so what is the outcome of patients who are suffering from RLS? So one thing we know is that RLS is a disease which, it's a chronic disease, lasts for several years. And in some people, the disease can get worse also. In some people, we find that there is waxing and waning. So they have symptoms for a few months, then they may not have symptoms a few months. Again, it can recur. So generally, they don't get cured, but with the help of medications, then the patients do feel better in their symptoms. And just one more point to add, RLS can affect any age group, and both genders are affected, but slightly more common in women. So I hope you found it useful. Thank you.